हाँ नमस्ते, मैं डॉक्टर प्रसून चैटर्जी from All India Institute, New Delhi. I'm a geriatrician, so I take care of elderly people especially. So I would like to discuss about a common ailment, what happen with aging. So regarding common ailment, I want to mention there are two form of problems, medical problem what happens with elderly people. One is age, due to age related changes, that is as the machine is getting old, so that is the problem, that is called age related changes. These are not disease, so these things mostly we have to accept and we have to work on it. Second group is age related disease, which we have to work on. So let me start with age related changes, like your hair color will be white, so that is your age related changes. Skin will be dry. So dryness of skin, many people confuse as this is a problem, so they go to many doctors and they start anti-allergic, even steroid, so which is not advisable. Take plenty of water, which will take care of your dryness of skin, and if required you can take use some emollient. You should use coconut oil in your skin to prevent your dryness of the skin, and you should clean, you should take bath every day. So that is one point. Then comes your with aging, you may have cataract also, which is again because the lens is getting old. So but it must be treated because vision problem will create many things in your life. For vision problem people have fall, for vision problem people gradually develop dementia, so we have to take care of that. Then comes hearing problem, is called presbycusis. What happen is with aging you have some dryness in your ear, and then gradually your nerve gets damaged, which we call as sensory neural hearing loss. So that point you have to get treated, because studies have shown that somebody who has hearing loss, he is more prone to develop dementia, because he or she is losing his sensory input to brain, so they are more prone to develop memory loss. So definitely if you have a problem, there are some problem with adjustment of hearing aid, but you talk to your ENT surgeon, you talk to the person who is provided you hearing aid, but you must take hearing aid if you have hearing problem. Then comes your memory impairment, forgetfulness. Let me tell you one thing, with aging what happen is the speed of your memory may be little slow if you are not working on it. Your registration process will take some time. Registration means, if I give example that your spouse has told you to bring something from market, and she has mentioned 3 or 4 things and you have brought only 1 things. So what happened is during when she told you 3 things, that time you have not registered well. So for registration we have to have attention, we should hear it properly, and we should just augment the process we should recapitulate 3-4 times that okay, these 3 things I should bring. Then so registration will take time, but once registered your output will be as good as young people. So basically this cognitive problem is not always memory. It can starts with your language, it can starts with your balance, it can starts with your some behavioral abnormality. So we should not ignore any of this symptom. If somebody suddenly has some speech problem, somebody has some visuospatial problem. Visuospatial means like you are taking stairs, you have problem, you are prone to fall. So that may be a early feature of dementia also. You are not talking coherent, you have some form of apathy, you have more anxiety which is disproportionate to your problem. You must consult a doctor, you must go to a doctor, because dementia is something which once sets in, there is no definite cure. So we have to prevent dementia. Then comes social isolation. Again, depression is very underdiagnosed in elderly people, because we thought that oh okay, aging has happened, so you are not working, so you are partially depressed, you are not like anything. But any form of depression sign, like not doing well, not feeling well, not happy at all, most of the time you feel that you are sad, you are prone to cry, you must visit a doctor, especially a psychiatrist, for your treatment. Then problem of mouth, many people suffers from loss of denture, which is again common. If you have no denture, please go and meet dentist and get your proper denture which is properly fitting, because chewing is very important for digestion. So so you have to have, even at the age of 100 years you can resettle your denture. Dryness of mouth, which presents as burning mouth syndrome, burning sensation in the mouth, it happens especially in the 80+ population. You must consult a geriatrician if you are available, because it is due to dehydration, because salivary secretion is less with aging, so you may feel burning sensation. Treatment is artificial saliva, you must get a treatment from the doctor. And then comes your digestion problem, which is again very common. People say that we are not getting digested, because with aging what happen is the food pipe movement is less, we call as decreased motility. So what happen is, so most of the food you are taking is storing in the stomach. So after 3-4 hours, usually after 4 hours the food should go down to the next part of the food pipe, but in case of aging with motility problem, it is not happening. So you may feel indigestion, gastric problem, acidity, all these complaints, which is very common problem. But the treatment is, more and more you do exercise, more and more you mobilize yourself, the food pipe also will move equally. And but what are the alarm sign when you should go to the doctor? If you are losing weight, if you are anemic or feeling very tired, if you see black color stool, like hair stool, then you must go to a doctor. Then probably you have some GI problem, actual problem. But I will definitely discourage over the counter drug for gastric problem like pantoprazole, omeprazole, ranitidine, famotidine, which is very common in this country and across the globe. And studies have shown that 60% even doctor prescribe pantoprazole, which is not appropriate. So rather, pantoprazole, omeprazole group of drug in long run causes dementia due to vitamin deficiency. So you have to take care of that. So food suggestion should be you take small and frequent food. That is very important. Small and frequent food you have to take plenty of vegetables, plenty of water, as much you can take. Then comes constipation, related to same thing. Constipation is also mostly in elderly people due to motility problem. So definition of constipation I must say here, which is a very vaguely diagnosed by most of the elderly people as well as sometimes doctors, that you must pass motion every day adequately. That is not true. Actually, if weekly thrice somebody passes motion is normal. But as compared to our common belief from our childhood that we should clear motion every day, and remember, from motion, if you have not passed motion, that will never cause indigestion, that will never cause headache, that will never cause chest pain. All these are psychological, our dogma, our thought process, which is there, which is embedded in us for long time. So weekly thrice if you pass motion, which is absolutely normal. You need not to go to motion every day and you have to pass a lot of, that is not true. So incompleteness is again a factor which haunt us, that oh, I have passed motion but it is incomplete. Again, don't worry for the motion, quantity of motion, you should feel comfortable, and as I mentioned, 3 days in a week is normal. So then comes your joint pain, which is again common due to, as the muscle is holding the most of the joint. As the muscle is weak, so joint is coming closer, it is having a friction and it is causing pain, which we call as osteoarthritis. Osteoarthritis can happen in the cervical region, in the neck, it can happen in the shoulder, it can happen in the elbow, it can happen in the knee. All are due to closeness of the two joint, two bone together and getting a friction. So you take plenty of water so that the joint space fluid is maintained. You maintain some posture, you should not sit down, you should not take many stairs which will have friction in your knee. You can understand it is like this movement is happening in the knee always. So knee joint pain, which is called osteoarthritis, is very common. So if you have knee joint pain or cervical spondylitis or pain in the shoulder, you must visit a physiotherapist and not a doctor. I'll underline here. So treatment is exercise, not medicine. So you have to get proper exercise by a physiotherapist who will work on the surrounding muscle. Once the muscle is strong, the joint space will increase and it will help you. If your knee pain is not getting subsided with adequate physiotherapy, then you must visit a orthopedic surgeon for the replacement of knee. These two are the only treatment. There is no painkiller available. You should not take any supplement, any painkiller to take care of knee. Regarding joint pain, here I must stress the need of calcium. You must take calcium every day after 30 years of age. Everyday calcium is a must for each and everybody. And remember, supplemental calcium does not cause a stone in the kidney, which is a very wrong concept. Regarding vitamin D you must check annually once, and if there is deficiency you should take it. Else not. Vitamin D should not take indefinitely. Vitamin D should be checked every year, and as per requirement you should take vitamin D with consultation with your doctor. Then there is a problem or literally that is called food problem. Food problem means you should clean your nail, which is again not very cleaned. You should take care of fungal infection. You should wear proper fitted shoes, because otherwise you will have a chance to fall. Some people complain of breathing difficulty. One is lung is getting old, so lung capacity is reduced. If you have not done exercise properly or not doing exercise, solution is exercise. Consult a doctor, check your PFT, not more than that. Still you can have the problem. Regarding heart, breathlessness can be due to a heart problem. With aging, what happen is the triggering machine, that is SA node, is getting old. Its cells number is getting reduced, so there is chance of block, and you may require a pacemaker. So you must talk to your doctor, visit a cardiologist or a generalist to get a consultation, to do a ECG and understand the problem is there or not. Regarding your this pacemaker, one symptom may be syncope. Syncope means sudden loss of consciousness. This is again a very frequent cause of maybe your heart is not beating properly or in a regular rhythm. So these are few age related ailments which I try to cover. Thank you.